Bones of upper limb. Scapula, it lies at the back of the thorax. It forms the posterior part of the shoulder girdle. It has 2 surfaces, 3 angles, and 3 borders. The surfaces of scapula are 1. Anterior or costal surface, it is called as the suprascapular fossa. It lies nearest to the ribs. Subscapularis muscle is attached to this surface. 2. Posterior or dorsal surface, it is divided into 2 fossae by spine of scapula which ends with acromion process. The fossae are A. Supraspinous fossa, which is the upper one. It gives attachment to supraspinatus muscle. B. Infraspinous fossa, which is below. It gives attachment to infraspinatus muscle. The borders of scapula are 1. Superior border, it lies in the upper part. It extends from the superior angle to the base of coracoid process. Suprascapular notch is at the inner extremity of this border. The suprascapular vessels pass through this notch. 2. Medial or vertebral border, it is nearest to vertebral column. It extends between superior and inferior angles. 3. Lateral or axillary border, it is nearest to axilla. It lies between inferior angle and glenoid cavity. The angles of scapula are 1. Superior angle, it lies at the junction between superior and medial borders. 2. Inferior angle, it is the junction between medial and lateral borders. It is the lowest point of the scapula. 3. Lateral or external angle, it contains glenoid cavity which receives the head of humerus. Clavicle, it is also called as collar bone. It is a long and curved bone. It forms the anterior part of shoulder girdle. It contains a shaft, 2 ends, and 4 borders. The ends are medial or sternal end. It articulates with sternum. Lateral or acromial end. It articulates with acromion process of scapula. The borders of clavicle are superior, inferior, anterior, and posterior borders. Humerus, it is the longest bone of upper limb. It contains 2 extremities and a shaft. Upper extremity, it contains 1. A hemispherical head which articulates with glenoid cavity of scapula. 2. Anatomical neck which is below the head. 3. Greater tuberosity which is below the anatomical neck. It is in the outer side of upper extremity. 4. Lesser tuberosity which is also below the anatomical neck. But, it is at the front. 5. Bicipital groove or intertubercular sulcus, it lies in between these 2 tuberosities. 6. Surgical neck, it is a narrow point of the bone below the 2 tuberosities. Shaft, it contains 1. Deltoid tuberosity which is a rough tubercle on the lateral aspect of the shaft. It receives the insertion of deltoid muscle. 2. Spiral or radial groove which is an oblique groove across the back of the shaft. The radial nerve passes through this groove. Lower extremity, it contains 1. Trochlea which is a pulley-shaped surface on the inner side. It articulates with ulna. 2. Capitulum on the outer side. It articulates with radius. 3. Coronoid fossa which is a depression. It lies above the articulating surface for ulna. 4. Olecranon fossa which lies at the back. It receives the olecranon process of ulna. 5. Medial and lateral epicondyles which lie on each side of the articulating surfaces. Ulna, it is the innermost bone of the forearm. It contains 2 extremities and a shaft. Upper extremity, it contains 1. Coronoid process which is a projection in front. It fits into the coronoid fossa of humerus. 2. Olecranon process which is an upward projection at the back. It fits into olecranon process of humerus. 3. Trochlear notch which is formed by these two processes. It articulates with trochlear surface of humerus. 4. Radial notch which is on the outer or lateral aspect. It articulates with head of radius. Shaft, it is tapering towards the lower end. It contains surfaces and borders. It gives attachment to 1. Muscles which control movements of wrist and fingers. 2. Flexor and extensor muscles of forearm. 3. Muscles of pronation and supination of forearm. Lower extremity, it contains head of ulna which is a small rounded eminence. It articulates with lower extremity of radius. Styloid process which projects downwards from back of lower extremity. Radius, it is the lateral or outermost bone of forearm. It contains two extremities and a shaft. Upper extremity, it contains 1. A head which is more or less buttoned shaft. 2. Neck which lies below the head. 3. Biceps tubercle which lies below and to the medial size of neck. It gives insertion to biceps muscle. Shaft, it is narrower above and wider below. It contains surfaces which give attachment to a variety of muscle. Lower extremity, it contains styloid process which is on the outer or lateral aspect.